Hi, day 7-ish. It's April 19th. Happy birthday, Mel. I love you. We will celebrate really soon. Last night was my first night in a true ICU. So a unit that had been at ICU before all this started. It was the surgical ICU, which has become, like most of the hospital, a COVID ICU. So all of the patients were either suspected or confirmed for COVID. I only had one patient just because there was enough staff for that. My patient was confirmed with COVID. He's been there for a few weeks, been intubated the whole time. His only past medical history I could find was diabetes. Obviously I can't give too many details, but he was stable for me, which was nice. It was a nice introduction to the management of the disease because I was able to really focus on patient care and not be scrambling, running around like a chicken with my head cut off, trying to stabilize him. So the patient was proned, intubated, and sedated. Kind of did that backwards. Intubated, sedated, and proned, which is one of the treatments they're doing for this. It's where we lay the patient on their stomach to allow their lungs to expand more, allows for healing, better oxygenation, better expiration of CO2. And it seems to be one of the go-to treatments for this. It is a pneumonia, which is something I have dealt with a lot when I was in the ICU. I don't feel completely comfortable with it, being that it's a new disease, and I haven't done it in about a year and a half. So I had a lot of questions. I had a lot of help. There were a lot of people working last night, which was cool. So there were a lot of resources, and worked with a couple of travelers from my agency and from other agencies, as well as staff nurses. The charge nurse on the unit was awesome. She was able to, once things got settled down, come over and spend some time with us travelers and talk about her experiences and how crazy it's been for them and how they've had nurses from their hospital in their ICU not doing well. Some of them have done well, some of them have died, some of them have recovered and are doing great. So it's hitting home for them. I can't imagine working on a coworker and not knowing whether they're going to make it or not. It's a crazy situation to be in, and I don't wish it on anyone. But she did express how grateful they were to have so many travelers and so much help and the relief that they need to cope with this, personally as well as professionally. So that was cool. It really was kind of invigorating for me to be in an ICU because it's something that I have missed since I left the ICU. I love my OR, and I'm happy I got to have this experience, and then I can go back to my nice calm OR where things are as they should be or will be as soon as this is over. So that was kind of it. It was a good night. I'm happy. I'm going to bed content and with my rotisserie juice, which I've become obsessed with. So I will update more tomorrow. Good night.